So hello, everyone, and welcome to today's CID speaker series. My name is Sarah Luttrell, and I'm the Communications and Events Manager for the Center for International Development at Harvard University. I'm really excited for today's session on COVID-19 and nutrition. The format for today's session, like other sessions, is a 20 to 25 minute presentation and around 15 minutes for Q&A. During the Q&A session, we just ask that you either use the raise your hand function and you can ask your questions directly of the speaker, or you can put your questions directly into the chat. And I will be reading those questions out loud. So, and please feel free to throughout the presentation, if you have questions, to leave them there and we'll get to them at the end. We're also recording today's session. And so this session video will be available on CID's YouTube channel after the event. I'll also add links in the chat to sign up for our newsletter and for our YouTube channel to hear more about events like this. Our next speaker series event is on Friday, March 12th with Alex Peterson-Zwain. She's the CEO of the Global Innovation Fund, and she'll be speaking on effective assistance, women's empowerment, and the SDGs in a post-COVID world. So we hope that you'll also join us for that event. But without further ado, I would like to introduce today's speaker, Shawn Baker. Shawn is the Chief Nutritionist with the U.S. Agency for International Development. In this position, he chairs the agency's Nutrition Leadership Council, oversees the vision and strategy of the agency's Center for Nutrition in the Bureau for Resilience and Food Security, and coordinates related efforts across USAID. He also guides USAID's investments and engagement with partners to address malnutrition in developing countries. So I know that we're all excited to hear from Shawn today. So thank you for being here, Shawn, and over to you.
Thanks so much, Sarah, for the introduction. Thank you, everybody, for joining today. A real pleasure to be here. It's, to me, anytime I have an opportunity to talk about nutrition, I really seize it. I've been obsessed with this issue for going on 4 decades. I hope today to be able to make the case that that is an evidence-based obsession. And if I'm really successful by the end of this period, you will also be at least partially sharing my obsession. Hannah Gedine, my colleague, is going to share the burden and help advance the slides here. So Hannah, if you could go to the next slide. We've organized the talk today about just go back to the basics of why we invest in nutrition. It's so important. Talk about what I call the nutrition revolution that started back in 2008. Then move into really COVID-19. What are the projected impacts? What do we need to do to mitigate those impacts? Position why this year, 2021, is such a make or break year where we can go into a redecline and reneglect of nutrition or re-energize and build a better nutrition system going forward. And then share with you quickly some actions and resources. So if we could go to the next slide, Hannah. Stepping back and really the evidence base of why nutrition is so fundamental. Almost half of all child deaths are attributable to undernutrition, meaning that if those children had been well nourished, no matter what their immediate cause of mortality was, they would be alive today. So that's a stunning figure of almost half of under 5 deaths. In addition, and very importantly, for those children who survive malnutrition, we've really compromised their cognitive and physical development. And so we've not set them up for good futures. We understand more and more what the drivers of malnutrition are, including how important poor diets are, or how if you review low and middle income countries, only 18% of infants and young kids in that critical period get a minimum acceptable diet. We also know that there's a growing burden on health and mortality of poor diets, either unhealthy diets or unsafe diets. On the other hand, while this is very grim, we actually have an incredible set of high impact evidence-based solutions that are some of the most cost-effective in all of development. And we know if we do not invest in nutrition, invest in safer food systems, we have massive loss, not just of lives, but also of productivity. So there's a huge reason to invest in nutrition. Unfortunately, despite this burden, the incredible evidence base of what works, if you look at global donor financing, we still have a very anemic financing going to nutrition, of less than 1% of official development assistance going into nutrition actions. And so that's what the case is of why we invest, but why we need to invest more. And if I can go to the next slide, we also know where the damage is happening. If you look through the life cycle, and one of the breakthroughs in 2008 was really to understand nutrition as a broad problem, but the biggest damage is done within the 1,000 days, from conception through the child's second birthday. And that has really allowed us to focus in the areas that need the most attention. We're seeing more and more of how much of the damage is done in utero, and one estimate is that over 800,000 children's lives are lost just in that first month because, in fact, they suffered malnutrition in utero. We also know that despite the incredible impact of breastfeeding, we still lose over 820,000 lives a year because of suboptimal breastfeeding. And then from 6 months on, when children need more than just breast milk, as I've said earlier, we're really not providing even the minimum adequate diet. 82% of children in low and middle income countries do not receive a minimally adequate diet. And of course, that combination of poor nutrition and then infectious disease leads to wasting, which is the most severe form of malnutrition, which is immediately life-threatening. And while we've made advances in managing wasting, we've really not scaled that up as a non-negotiable intervention for the health sector to deliver to all children who need it. And then in a broader food systems perspective, we still have a huge burden of deficiencies and essential vitamins and minerals. And just to take one case, something as simple as folate deficiency, and folate is essential for development of the neural tube, we still are losing around 170,000 children a year because of folate deficiency, where we have proven solutions such as adding folic acid to wheat flour. So we have a better understanding of the burden, where it's happening, and what we need to do to solve it. And that focus on the 1,000-day window is really critical. And while I presented this of the areas of concern, I think because I'm an optimist, I often also flip it on its head, because if we get nutrition right during this period, we know we've also then locked in potential to survive and potential to thrive in the future. So it's one of those really irreversible investments if we do this right. If I can move to the next slide. And so stepping back, we have a huge problem. We have a solution set. We know what to do, but we're underinvested. And what are really the root causes, to my mind, of this underprioritization of nutrition? And I summarize it in 4 words: orphan, invisible, unmeasured, and voiceless. Orphan, because it's never really clear in a government structure who's responsible for nutrition. Is it the Ministry of Health? Is it the Ministry of Agriculture? Is it the Ministry of Social Protection? Is it the food industry? Well, and of course, at the end of the day, you need those different parts of the system to work together to deliver good nutrition, but there's seldom a high-level coordination mechanism which holds those sectors accountable to deliver on nutrition. That status of orphan is exacerbated by the invisible nature. And often in the mind's eye, when you think malnutrition, you're thinking of that severely wasted child who needs treatment. But in fact, that's only the tip of the iceberg. And so much of the malnutrition is invisible, be it deficiencies in vitamins and minerals, or children who have just not grown so well. So if you go into a village in Niger and every child has been stunted, that just is the norm for families, for decision makers. That invisibility is made even more severe because we are still not measuring adequately nutritional status and the coverage of our nutrition services and the quality of diets. We have made progress, but one of the big clarion calls, for example, of other sectors like HIV was know your epidemic and know your response. There's still parts of the nutrition agenda where we do not have adequate understanding of the magnitude and the solution set. And then fourthly, but I think most fundamentally, it's voiceless, because those moms and kids, the most risk at malnutrition, are the least likely to have a place at the table. And unless we are actually finding who's most at risk and making sure they're getting the services, we're not going to make progress. Hannah, if I could have the next slide. Now, I'm excited about how we position nutrition in the last 13 years or so, but I also always put a vote of caution, because this problem is not new. It goes back to at least our understanding back to the 90s, where there was this pie chart that was often used of looking out at what I call the donut of childhood, child mortality, with all the causes and this hole in the donut of deaths associated with malnutrition. Despite this knowledge and despite a UNICEF conceptual framework saying that we need to bring the different sectors together, it had not galvanized the political support, the financial support really necessary to drive impact. And I have three takeaways here. One, that language matters. Associated with malnutrition is something that is not very, very compelling versus saying this is really causing mortality. Secondly, the way you use evidence matters importantly, because while this evidence was published, there was not a concerted effort of the advocacy community to actually take this knowledge and drive policy and financial action. And then thirdly, more cheekily, I think it shows that people like to eat the donut, not the hole in the donut. And then you can see this led to, even in we'll see in the next slide, when we have a big chance as a nutrition community to position nutrition in the Millennium Development Goals, it was really a big missed opportunity. It was really forgotten. It was bundled down as a footnote in one of MDG 1, the one that said have between 1990 and 2015 the proportion of people who suffer from hunger. And there was one indicator trailing down there about the percentage of child underweight. But this combination of, despite the evidence, the lack of attention, the lack of a focus on the message about what the solutions are, meant that there was rarely talked about, rarely invested in, and very rarely, with a few exceptions, acted upon at scale. And that sets the stage for the next slide, where in my telling, the nutrition revolution really began, going back to late 2007, early 2008, where there were a series of events that came together which really catalyzed an evidence-based revolution. There was a global food price crisis, which decision makers around the globe got energized by food and food security issues, not necessarily nutrition, but at least it started getting us a place at the table. There was a breakthrough publication, the first of the Lancet series on maternal and child undernutrition, which brought together a technical consensus, brought together the consensus we need to focus on the 1,000 days, but also did a political economy analysis, which was a real slap in the face in the nutrition community, saying the global nutrition system is broken, and that really was a call to action for us to get our act together. This led to, among other things, in the launching of the Scale Up Nutrition movement, of an ability for the different actors in nutrition to come together with one voice, and also to inspire countries to start solving that orphan problem and create the coordination mechanisms to bring the different parts of government together to act in synergy. In 2012, there was a big breakthrough at the World Health Assembly, where the world adopted 6 nutrition targets, which have really been embraced, covering the issues I've related. And then in 2013, we started getting much more serious about financing for nutrition. Prior to that was for the first ever Nutrition for Growth Summit. So unlike mechanisms like the Global Fund or Gavi, where there's a big push for replenishment, nutrition had never had a big commitment moment to really push more investment and smarter investment in nutrition. And that Nutrition for Growth Summit was informed by a second in the Lancet Under Nutrition series, which has really provided updated information that's guided our work. And that set the stage for the Sustainable Development Goals for nutrition to be much more well-positioned, embraced in Sustainable Development Goal 2, but also I think links to every other of the 17 Sustainable Development Goals. And that's why my virtual background says 2 equals 17, making the case that investing in nutrition is going to have knock-on effects for everything else we care about in sustainable development. So we were on a great trajectory. There was a period of, let us say, turbulence, because part of Nutrition for Growth 2013 was the government of Brazil agreeing to organize the next Nutrition for Growth Summit as part of the Rio Olympics. Now, there's a tale there that I will talk about another time of a pandemic, political meltdown leading to an impeachment and an economic meltdown that Nutrition for Growth event in Rio never could happen. But the community rallied to repurpose an event in Milan in 2017, which kept this trajectory of increasing prioritization and investment in nutrition. And we were rolling through 2019 with a huge amount of excitement. And one of the capstone events really was the Scaling Up Nutrition Global Gathering, where we now are celebrating 62 countries and 4 states in India having joined the Scaling Up Nutrition movement, really prioritizing nutrition action and national leadership to resolve the malnutrition crisis. And then, of course, 2020 hit us, and I'll build a bit more on 2020. But before I move into what hit us in 2020, if we can go to the next slide, what has all this led to? And if you go on the left, you can see of 2013, we had made a pretty significant increases in nutrition investment. Now I'm looking only at investments coming from donors. Obviously, it's very important looking at investments from governments of countries with high burdens of malnutrition and other actors, but this is an easy way to trace the trends in nutrition investment. Where we move from a baseline of around 400 million a year, mind you, 45% of under 5 mortality and only 400 million a year going into it, to where we're hovering around 1 billion, 1.2 billion. Now, that's good, but as we see on the right, it's not good enough because even to scale up the most basic of interventions, the price tag is significantly bigger. There's another vulnerability that is important to call out because even within that about 1.2 billion, if you take the top 6 leaders of the pack in that, they cover about 90% of that. That includes the United Kingdom, the US, the European Union, Canada, and then the World Bank and the Gates Foundation. And of course, having only 6 big players is a source of fragility and vulnerability. And we've seen that play out now with the United Kingdom backtracking on some of their investments in nutrition. And this is all, so progress, but not enough. And then 2020 hit us, a new pandemic, if I can go to the next slide. And basically, COVID-19 is positioning us to potentially wipe out over a decade of progress because every system we rely on to deliver good nutrition, health systems, food systems, people's livelihood, and so ability to buy food and to access health services, those social safety nets, which are so important to buffer, and even our ability to deliver in humanitarian settings have all been disrupted and affected. A group of researchers have come together to try to model across all those different sectors, what is the likely knock-on effect of on nutrition in 2020, 21, and 2022. And it estimates a really major increase in the number of children suffering from wasting, a reduction in the coverage of nutrition services, and that combination of an increase in cases of wasting and reduction of nutrition services could result in an additional 168,000 child deaths. And there are longer term impacts of children who are going to have suboptimal growth, and that has a generational impact, and impacts on mothers, which is bad for their own health, but then also very bad for the children they will bear. And it was also estimated that in order to mitigate those impacts, on top of those estimates I showed you earlier, we would need about $1.2 billion addition per annum for the next 3 years. So it's raised the bar of what we need to galvanize. What's less apparent here is the blow to that political trajectory I've talked about, because now with governments and decision makers' attention being paid to many other things, there's a risk that nutrition not come through as not just still a priority, but in fact, even more of a priority than pre-pandemic. If I go to the next slide, that being said, and this is taking from USAID's experience and then a number of our partners' experience, what has been energizing is the way that people on the ground, the tenacity of our partners, our government partners, has been to really pivot to try to do our best to mitigate these impacts, to really keep the supply of nutritious foods flowing, to use all the infrastructure of communication for nutrition that is in place to integrate COVID messaging, to adapt counseling on infant and young child feeding so it's less, you reduce transmission risks, to really come together to have a common message about what the likely impacts are and what we need to do, and to constantly convene stakeholders to share lessons learned and recommendations, and in fact, learn from each other. And so as we go forward, what we are stressing is that those projections are incredibly grim, but projections are not destiny. And there are things we can do with the necessary resources, the expertise on the ground, the financial resources, the political will, to in fact avoid the worst of that, and in fact even deliver more. Some of the priority actions make sure that we keep nutritious foods, including fortified foods, that we have catch-up campaigns for life-saving nutrition and health services, including vitamin A supplementation. Many of these campaigns have been suspended during the pandemic. That as we rebuild health systems, we really focus on those community platforms who are really at the front line, the most powerful forces to deliver good nutrition services to moms and kids. That we actually take advantage of all the incredible innovations in social behavior change, wasting management, et cetera, to use those going forward to accelerate progress. And that as governments respond to the increased poverty driven by the pandemic, that those social safety net programs are shaped in a way that they will prioritize supporting families to have access to nutritious foods and nutrition and health services. And that brings me to this make or break year. The next Nutrition for Growth Summit was so it started with linked to the London Olympics, was supposed to be passed to the Rio Olympics, which didn't quite happen, and then was going to be passed to the Tokyo Olympics. Well, the government of Japan remains committed to organizing Nutrition for Growth, but of course it had to be postponed for a year. So this is a year where we've repurposed it, instead of being just one event, to have a year of action for Nutrition for Growth, which actually, in many ways, there is some serendipity there. We've started a third phase of the Scaling Up Nutrition movement, which is really re-energizing and refocusing that country level action. The kickoff event started in December of last year with the governments of Canada and Bangladesh stepping up with financial commitments and programmatic commitments. We have new evidence informing this year of action. These estimates on the potential impacts of the COVID pandemic, and there will be a third in the seminal Lancet series on maternal and child undernutrition, which will be launched on March 8th. And then internally within the US government, we have two big activities going on: a refresh of our global food security strategy, which is the basis for Feed the Future, and an updating of our global nutrition coordination plan. And so along the year, we're looking at these other key events where we need to position nutrition, call out for action. That will include an event with the African Union, the G7, potentially event at the Olympics. Incredibly important will be the United Nations Food Systems Summit to really drive attention to that need to make sure that food systems are delivering safe, affordable, nutritious foods, particularly for infants and young kids and moms and populations who are the most marginalized. I think with COP26, we're seeing the climate crisis is leading again to a meltdown of all these systems that deliver good nutrition, and an opportunity again to elevate the risk of increased malnutrition driven by the climate crisis. And then there'll be a big capstone event where we bring all these together in Tokyo, either in person or virtually or some combination, led by the government of Japan for the Nutrition for Growth Capstone Summit. So I think a really exciting year, and a year to an opportunity not to say it's just grim, but actually we can do action and reposition nutrition as an essential priority as we rebuild from this pandemic. And so the next slide, as I was preparing this presentation and trying to put myself in your position, is like, well, great, we see the problem, what can I do? And I tried to distill it into 4 words of learn, amplify, volunteer, and give. I think learn, it's actually quite interesting how many people, even people very engaged in development issues, don't understand just some of the basics of how fundamental nutrition is. So the more you can get conversant in nutrition, the better prepared you are to engage. And then use your voice to amplify that learning, share your newfound passion with others in your network. There are also, and I found this, there are opportunities for volunteering here in the US and globally. For the US, there's a whole host of really great nutrition partners working domestically and internationally. And then there are also, personal giving is also invaluable. Having worked in the NGO sector all my life, of course, I spent a lot going after grants, but even small donations that have unrestricted funding can be incredibly powerful and really show that the broader public is interested in an issue. And of course, finally, there's always the opportunity, if you really get passionate like I did, you can repurpose your career. I actually will reveal that I was supposed to be a marine biologist. That's what my undergraduate degree was in, marine science and biology. And a stint in the Peace Corps in Zaire converted me to the nutrition agenda. But my point more broadly is that there are many different buckets of expertise we need to bring to the table to deliver on nutrition. It's not everybody has to be nutritionist to actually make a major contribution to the nutrition agenda. And so I wanted to close with 2 slides. The first, and we're going to share these slides at the end so you can click on these links, are some resources that may be useful in your own journey of learning and amplifying. You're quite welcome to tune in to that March 8th launch of the 3rd Lancet series on maternal and child nutrition. The Global Nutrition Report, which was one of the commitments of that original Nutrition for Growth Summit, has really become the go-to one-stop shop for nutrition information across the world. There's the publication I referred to about the impacts of COVID-19 on nutrition. I have been recently coerced by a dear colleague to join LinkedIn, my first ever foray into social media. And there's a post up there basically laying out what's at stake. And also we're communicating more on nutrition. There's the Nutrition for Growth website. And then there are a couple of publications that are more driven by USAID. And then I also threw in there a book that I found useful in my own family when I'm trying to communicate to my aunt or my uncle or my sister who are interested in my work but don't quite understand a lot of the in-depth technical issues. A journalist, Roger Thoreau, has written a book called The First 1,000 Days, which I found to be a very impactful telling of the story of the power of nutrition. And with that, I wanted to close with this slide. For those of you who followed the inauguration on the 20th, I don't know if you captured these words that came out of that President Biden spoke, but I found them, for somebody who, again, has worked in this field for 40 years, incredibly inspiring that the first day in office, he's already focused on the issues of malnutrition, both here in the US and abroad. So with that, again, thank you very much for joining me and letting me share some of my passion, obsession, evidence-based obsession for nutrition. I'm very happy to take any questions.
Great. Thank you very much, Shawn. I know I definitely learned a lot. If anyone has any questions, please feel free to use the raise your hand function, and I can call on you to directly ask questions, or you can leave a question in the chat. I guess I'll ask the first question while people are kind of formulating their thoughts. But I was interested, Shawn, when you had mentioned that the Millennium Development Goals and the Sustainable Development Goals had, there was quite a shift in kind of the focus on, and I don't know if it's nutrition or food and food systems kind of was the shift. And so it was a footnote in the Millennium Development Goals. How does it play out nutrition in the second goal for the Sustainable Development Goals? Is it more focused on nutrition or other aspects of food systems?
There are other aspects of food systems, but clearly, I mean, it's a bold declaration of ending all forms of malnutrition. So that's a pretty, whereas in the Millennium Development Goals, again, the actual wording is incredibly anemic, as it were, every pun intended, of half between 1980 and 2015, the proportion of people who suffer from hunger, which you don't even know what that means, where that's quite different than saying ending all forms of malnutrition. But then more importantly, it also embraced those World Health Assembly targets with hard measures on stunting, wasting, anemia, low birth weight, and childhood obesity. So it didn't have just bold ambition, it also is linked to those World Health Assembly targets, which we've all rallied around. Now, so I think it's a pretty big shift.
Yeah, it sounds like that is a big move. And I mean, it sounds like kudos to the environment of and folks in the world of nutrition for kind of moving that agenda forward. But it sounds like there's still a lot of work to do, particularly in light of COVID and lots of things happening around the world and lots of agendas for people to be focusing on. I guess another question for you is in the future of nutrition and focus globally, what are some more priorities for you in terms of the focus of beyond just the Sustainable Development Goals for people being engaged in nutrition? I know that you've thought of ways that students can be engaged, but kind of more so globally, I guess, with nutrition.
Yeah, and if I step back, I think I'll probably respond to that from more the political economy and then the systems and the technical issues. But let me start perhaps with the political economy. I think while the Scaling Up Nutrition movement from the beginning, this was governments of countries with high burdens of malnutrition signing up and committing to do more on nutrition and recognizing that it takes different sectors to act together, it takes political prioritization and a good coordination of other stakeholders. That's been there in the DNA of the movement since the beginning. As we moved into this third phase, the degree to which that's actually played out, it's easy often to make commitments. Living up to them, as we all know, is what is more challenging. And so I think one of the most important things, again, is getting that structure and coordination right in country. And having, at the end of the day, the bulk of the resources is going to be coming from governments, coming from other actors in country. We as donors, we can help, but there's no way we can substitute for everything that needs to happen. And what you need to have is make sure that, okay, the health system is delivering what it needs to do. When I do a social protection program, it's doing what it needs to do. When I do an ag program, it's doing what it needs to do. And the issue when you have in any government structure, no ministry wants to be coordinated by a partner ministry. You need to have somebody at a higher level who has the mandate to do it and the teeth to do it. So that I think is that, and that to that happen, it needs to be either a head of state or a prime minister, a ministry of finance, who is really empowering a structure that has teeth to hold the other sectors accountable.
Mm.
From the more of a technical side, we have a lot that we know about how to deliver on nutrition. There is this no delivery gap, right? So I think we have several areas where I think are almost quick wins of the known solutions. How do we actually take rigorously what I call the science of scaling up, or the science of delivery, implementation science of understanding how do we actually get these solutions out? And it's not just an art, there's a real science there, and applying that rigorous assessments of how do you take solutions to scale. There remain some unknowns. For example, our ability to assess micronutrient status is really very pathetic. That's a real problem, because you need to know we don't routinely have good data on what people are eating. Well, how do you talk about having a food systems delivering nutritious food if you don't understand what people are eating? Here in the US with Ann Haynes, we invest routinely in understanding what people eat, and we actually adjust our policies in function of that. So those are some core investments. But I wanted to get back to even your first point of there's so many other agendas. And I think making the broader development community understand that nutrition should not be seen as competing with other agendas, but in fact, in the foundation of almost every other agenda. I mean, who cannot want to save kids' lives? Well, nutrition provides incredibly important tools. Who cannot want kids to do well in school? Well, we know if we lock in that potential in the 1,000 days, those kids are going to be much better able to contribute to school. Who cannot want to bring populations out of poverty? Well, we know that, in fact, if we are condemning kids to malnutrition in their early childhood, their likelihood of doing well in school and doing well further on in life is reduced. So again, we can tack this on to many other agendas, and it's how do we take this evidence and position it and not be seen as competitors, but the best friends of every other sector.
Right. And yeah, it could be, I mean, foundational. I think nutrition is the foundation for our lives.
Yeah.
And so I know we have a number of questions, so I want to make sure that we can get to those. So I think, Deborah, you were first, so I'll just ask you to unmute and you can ask your question.
Great. Thank you, Shawn. My question was with regard to stunting and stunting related data. I know that over the past several years that the global stunting prevalence has dropped quite a bit, but that in some areas, particularly here I'm thinking West Africa, while the prevalence has gone down, the absolute numbers have gone up because of great improvements in infant mortality and child mortality, but also birth rates. I'm curious, from the data that you've been looking at in this sort of COVID, post-COVID environment, are you seeing changes to those dynamics at all? Or should I be keeping an eye out for the Lancet report?
No, it's a very important question and near and dear to my heart, because I spent so much of my life in West Africa. It's one of the few regions in the world, as you've rightly pointed out, where while the relative prevalence of stunting is going down, because of the population growth, the absolute numbers is increasing. And so, in fact, the global shift of the burden of malnutrition, where the bulk of it was really South Asia remains a big burden, but you're actually seeing more and more burden of the relative proportion of the burden coming to Africa, particularly sub-Saharan Africa, for the reasons you pointed out. The impacts of COVID on stunting, we're not going to feel right now. That's going to be, and I think that this is what is a very important message of, by not acting now, we're losing a generation, right? Because those kids who are born of moms who have not had adequate diets, not adequate health care, they're going to be born too small. They're not going to recover the growth trajectory. And we're condemning an entire generation of kids suffering from stunting, right? So that basic trajectory is still, as you say. Unfortunately, the anticipation is that even the relative reduction of that we have been seeing could be slowed down. And when you combine that with, if you look across the Sahel, the security crisis, the climate crisis, These countries that have actually been battling and making progress, not enough, but still progress, the bar has all of a sudden been raised dramatically more. So it's a real area that needs to be focused on.
Great. We have another question from Teresa Welch. So Welch, sorry, if you want to unmute and ask your question.
Sure thing. Hi, Shawn. Nice to see you. Hope you're well. I was wondering if you could give us any more details about how you expect USAID and the US government to engage throughout the year in the lead up to both the UN Food Systems Summit and Nutrition for Growth. What sort of conversations and organization is being had to determine, what kind of contributions, commitments you might be making. Obviously, you highlighted the commitment that President Biden has now made publicly to nutrition, and just sort of wondering how all that process is coming together. Thanks.
Right, and to a certain extent, we're still in the beginning, because the nominee for the administrator has not been confirmed by the Senate yet. But I think, to me, what's incredibly encouraging is, nutrition has had incredibly strong bipartisan support for decades. USAID has 50 years of leadership in nutrition. Personally, I tell the tale of just the day that I was confirmed that I'd be coming into my position, the Senate, so back in far ago, long ago, we all forget the early days of 2020, there was a unanimous resolution of the Senate reaffirming US leadership on fighting maternal and child undernutrition from the Senate. And then just the end of the year, I think it was December 7th, that same resolution was passed unanimously in the House. And the then acting Deputy Administrator of USAID joined the kickoff event of Nutrition for Growth and reiterated how strongly the US government remains engaged in nutrition. As we are currently undergoing the refresh of the global food security strategy and the refresh of our global nutrition coordination plan. And under that, I think that will shape a lot of what we are able to bring to the table. Now, in terms of other specific commitments, it's still early days, but we are deeply engaged in the Nutrition for Growth process and also in shaping the Food Systems Summit. And with the Food Systems Summit, particularly focusing to make sure that in the multiple demands we're putting on the food system, we bring to the table the need to make sure that a non-negotiable is to make sure that a food system is delivering safe, affordable, nutritious food, particularly for those populations with the greatest needs, infants and young kids, and those populations who are the most excluded. And I think that's probably pretty consistent with the policies we've had for the last 50 years.
Great, thank you. And I know I'm being conscious of the time. We only have 1 more minute. So we did have a question. We had a couple of comments in the chat. You've got a hello from Colombia, from Bogota. And then also Erica Strand was asking, she wants to know more about how the impact of COVID can be measured when household surveys will take a few years to show impacts. So she wants to know the impact of COVID on nutrition and how we'll find that out with surveys.
Right, no, great question. One of the innovations is the extent to which even data collection, I've seen this, can move to mobile platforms. And so while it's not sometimes perfect, there has been, there's been real tenacity of how do we adjust even our data collection. So one of the first things that dropped off was just access to services. And we've seen and so that has immediate, if you're not getting your vitamin A capsule, you're not being prevented. So that's immediate. The longer term, like stunting, we're not going to see for longer, and we also have seen from modeling, we know consumer behavior, poorer households spend an inordinate amount of their income on food, 80% or more. As soon as a household has any livelihood shock, it immediately has to focus on staples and then deprioritize more nutritious foods because they are usually more expensive. And that's been exacerbated in this pandemic because many of those foods are perishable. And if you have less access to markets, you're not going to take perishable foods that you won't be able to stake. So and we've seen this in the global food price crisis, et cetera, where you immediately have a decrease in the consumption of nutritious food. So some of this is projection, but it's projection based on other lived experiences and some validation. We have had constraints, as you said, of actually doing the direct surveys of nutritional status. And that's something we'll have to take up again once the conditions on the ground permit it.
Great. Thank you very much, Shawn, for all your answers. And I know that there's a lot of takeaways from today's discussion. So in the interest of time, we'll wrap it up. But again, thank you so much for joining us. And we hope, and thank you all for being here today. We hope that you'll join us again for the speaker series on Friday, March 12th with Alex Peterson-Zwane. And she'll be talking on investment agendas and women's empowerment and the SDGs in the post-COVID world. So again, lots of things that are relevant to today's discussion, and we can bring those ideas to that conversation as well. So thank you again for all being with us, and we look forward to seeing you again soon.
Thanks again, Sarah, and thanks everybody for joining.